Hello, Bermuda. As the epidemiologist at the Ministry of Health, I study diseases such as COVID-19 and how they impact Bermuda. I look for causes and patterns of disease in order to halt an outbreak or limit future spread. But I don't work alone. There is a team of us in the Epidemiology and Surveillance Unit. For COVID-19, I also have modeling software. This software allows me to adjust certain factors to see how they affect outcomes. One thing which we have found plays a leading role in our outcomes is the level of compliance in the community for public health measures like hand washing, mask wearing, and physical distancing. If I adjust the level of compliance, the model will show us differences in the number of sick persons, number of hospitalizations, and number of deaths. So let's say that there's one person with undetected COVID-19 in Bermuda. If as a community we do not follow the recommended public health measures, this could lead to over 200 sick persons, 10 hospitalizations, and 1 death in 60 days. If we did follow them, it could lead to only 2 sick persons with no hospitalizations or deaths. So remember, Bermuda, each of us has the power to control how this pandemic impacts our community. Wear your mask, wash your hands often, practice physical distancing, and no large groups. Stay safe, everyone.
Good evening, Bermuda, and welcome to the members of the media who are assembled here this evening. I am joined today by the Minister of Health, who will be providing an update on the latest from her ministry. Following that, I will give an update on decisions made this afternoon around Bermuda's public schools, matters related to containing the spread and increasing our testing capacity, and the We Health app launches Friday. Additionally, I will detail support that will be given to persons who have been displaced due to the latest actions that the government has had to take. First, we will start with the Minister of Health. Minister?
Thank you. Good afternoon, everyone. There were 929 test results received by the Ministry of Health yesterday on the 7th of December 2020, and 24 were positive for COVID-19. One of the new cases is classified as imported with the details as follows. One resident who arrived on Delta's flight 617 from New York on the 28th of November 2020 and tested positive on their day 8 test, having had a negative pre-arrival test and a negative arrival test. 16 of the new cases are classified as local transmission with known contact or sources, with the details are as follows. 4 residents who were already under quarantine as close contacts, 2 household and 2 workplace of known cases, 12 residents who were associated with known clusters. The remaining 7 new cases are classified as under investigation. These cases are amongst residents who had no history of travel or any currently identified links to any other known cases or clusters. Bermuda now has 330 total confirmed positive cases, and their status is as follows. There are 98 active cases, of which 96 are under public health monitoring, and 2 are hospitalized, with 1 in critical care. A total of 233 have recovered, and the total deceased remains at 9. The average age of all confirmed positive cases is 48, and the age range is from 0 to 101 years. To protect privacy and confidentiality, the average age and age range of those hospitalized persons will not be revealed. The average age of all deceased cases is 74, and the age range is 57 to 91 years. The source of all cases is as follows. 129 are imported, 156 are local transmission with known contact or source, 21 are local transmission with an unknown contact or source, and 24 are under investigation. It should be noted that as the investigations proceed, transmission categories may change. The 7-day average of our real-time reproductive number is greater than 1, namely 1.26. Bermuda's country status is under review, but is currently cluster of cases. The determination of the country's status is done in collaboration with the Pan American Health Organization, which reviews countries' data on a daily basis. As you can see, today's results are not good. 24 new cases to report in just one day. We must do better by curbing our risky behaviors that lead to further spread of COVID-19. And we must remember to do the following. Reduce your bubble sizes. Choose only one or two other households to socialize with for the next few weeks. When you meet others, meet outdoors and wear masks and observe physical distancing. Wear your mask properly. Wearing a mask with your nose is exposed is like wearing no mask at all. Consider postponing events until it is safer. Avoid indoor spaces, crowded places, and close contact. And ensure your workplace is also following the COVID-19 protocols. The ministry's contact tracing investigation strongly suggests that it is social mixing of gatherings of people that are most likely to produce the local transmission and positive cases, as is currently happening right now. Many cases are asymptomatic, so just because your friends or your coworkers do not seem sick does not mean that they do not have COVID-19, and they may be unwittingly passing it on to you. One glimmer of positivity in this week's statistics is that our current cases seem to be, for the most part, linked to well-defined clusters. This doesn't mean that there is necessarily a link to imported cases, but that's still some good news as far as a contact tracing perspective that can be linked to common exposure events and locations. But if people continue to ignore the public health measures, we will see more and more cases and we will head down the path to community transmission. Community transmission, as defined by the World Health Organization, means that you have so many clusters and so many unidentifiable instances of COVID-19 that it is impossible to find links between the cases. Fortunately, we are not at this point yet. However, as I said, we each play a very important and vital role, and we must play our own part to ensure that we do not get to community transmission. One thing that helps to protect our community is obeying the quarantine instructions. If the Ministry of Health has contacted you to tell you that you or your child is a close contact of a case and must be quarantined, this means remaining home from school, work, or other activities for 14 days. In the case of children, this means not attending birthday parties, sporting events, social or extracurricular activities. And I'd like to spend a few moments speaking about that last point regarding extracurricular activities. From the reports that I'm hearing, there seems to be a discrepancy between the school environment and the children's extracurricular activities in terms of ensuring protective health measures are followed. In schools, children are kept in their year group and class bubbles, something which the schools and the teachers have worked very, very hard to maintain. But in the sports clubs and during extracurricular activities, I'm hearing that children from many schools are meeting and interacting socially. This is making the bubbles that are created at the schools much less useful in preventing the spread. Therefore, I am appealing to parents and organizations that run these activities to please be mindful of this and act in accordance with the health guidelines that are posted on coronavirus.gov.bm. As it relates to parents who are watching their children participate in these activities, I want to remind you that if you are not able to physically distance, you must wear a mask. Yes, even if you are outdoors. I will now provide information on further testing opportunities for residents. First of all, I would like to thank those GPs who assist us with testing. Your help is critical to building up Bermuda's testing capacity. Our new testing schedules, which will be operational from the 14th of December, will provide testing continuity to our residents as it will not change by month to month, and it will be a fixed schedule. Also, we have added more testing slots, and the new locations create more capacity for community and group testing, as well as testing of those persons that are symptomatic. Furthermore, our new locations provide us with shelter from the elements, as they can be converted from a drive-through functionality into indoor locations. Currently, if it rains, pop-ups have to close, and these new locations give us certainty that testing can proceed, rain, blow, or shine, regardless of the weather. The new schedule will be as follows. Testing on Mondays will take place at the Bull's Head Car Park from 10 a.m. to 2 p.m. for non-symptomatic persons and 2 p.m. to 4 p.m. for symptomatic persons. On Tuesdays, testing will take place at the Star of India in Dockyard from 11 a.m. until 3 p.m. for non-symptomatic persons and from 3 p.m. to 5 p.m. for those persons with symptoms. On Wednesdays, it will take place at Pennell's Wharf in St. George's from 11 a.m. until 3 p.m. for non-symptomatic persons and from 3 p.m. to 5 p.m. for symptomatic persons. On Thursdays, testing will take place at the Star of India from 11 a.m. to 3 p.m. for non-symptomatic persons and 3 p.m. to 5 p.m. for symptomatic persons. On Fridays, testing will be at Bull's Head from 10 a.m. to 2 p.m. for non-symptomatic persons and 2 p.m. to 5 p.m. for symptomatic persons. On Saturday, testing will also take place at Bull's Head from 9 a.m. to 2 p.m. for non-symptomatic persons and 2 p.m. to 4 p.m. for symptomatic persons. And on Sundays, testing will take place at Pennell's Wharf from 11 a.m. to 5 p.m. for travelers and non-symptomatic persons. Persons can go online this evening. Can be located at coronavirus.gov.bm. Additional community testing was being arranged at PROT Post Office between 10 a.m. and 2 p.m. with the aim of starting that tomorrow. However, unfortunately, as a result of the increased numbers of positive cases which we've seen today, we must focus most immediately on the testing needs that arise from the contact tracing investigations of those 24 individuals. These are the priority cases, and regrettably, we cannot accommodate walk-ins at this time. To be clear, for those who have appointments at the pop-ups, we will be moving the appointments made from December 14th and afterwards to the new sites. We will send out an email correspondence directly to those persons with the new locations and the times for their testing. Going forward, there will be no more pop-ups at the marketplace. The Ministry of Health would like to deeply thank the marketplace for being such a gracious and accommodating partner over these last several months. This partnership has been critical for us to enable us to have the success that we've had with respect to the rigorous testing regime. And again, I'd like to thank deeply the organizers and the staff at the marketplace. I want to remind the public that effective today, 8th of December 2020, all residents and visitors to Bermuda are required to wear a traveler's wristband for the first 14 days of their stay. The wristband serves to remind travelers to be careful of their movements and follow the first 14 days guidance in order to help to minimize the spread of COVID-19. The wristbands also remind the public of the additional precautions for travelers during those first 14 days. However, I want to remind everyone that Bermuda's borders are open and we continue to welcome visitors and returning residents home. The increased number of COVID-19 cases has made it necessary to step up a number of precautions across many sectors in order to avoid more stringent measures. But Bermuda is known for our hospitality and our friendliness, and the wristbands should serve as a reminder to locals to extend a warm welcome to the wearer and show our traditional warm Bermudian hospitality. Whilst we have to maintain our physical distance, we can and must show even greater kindness and cordiality to all our incoming travelers. I should note that the removal of the wristband is not permitted and can result in a fine in the sum of $500, as well as home quarantine and the requirement to wear an electronic monitoring bracelet. Persons who do not wish to wear the traveler wristband will quarantine at their accommodation for 14 days. On Saturday, the Ministry of Health advised members of the public that an individual who attended the funeral of Charles Henry Eugene Eberly on Saturday, the 28th of November, 2020, at Malabar had since tested positive for COVID-19. We advised any member of the public who attended this event to call the COVID-19 hotline to arrange COVID-19 testing. So far, we are aware of 9 positives associated with this funeral. but we only know the status of those who have been tested. And therefore, we are urging anyone who went to the funeral to get tested. It is vital in ensuring that we halt further spread. On that same topic of getting necessary information, last night government issued a release asking for members of the public who had attended 3 particular venues at certain times during the weekend of November 28th and 29th to contact the Ministry of Health to arrange COVID-19 testing, as there had been a potential COVID-19 exposure at each venue. This advisory was issued because our contact tracers had not received adequate contact tracing information from these locations, and the advisory was the most expedient way to contact all of those individuals who may have attended these events. One site which was mentioned, which was Friday's Trampoline Park on the 28th of November between 11 a.m. and 9 p.m. We can confirm that Fridays has provided us with the required information, so those who need to be contacted will be contacted. Regrettably, we received this information several hours after we had requested it. As is the case with many investigations, the first 24 hours are vital in establishing the close contacts. I would like to take this opportunity to emphasize the importance of supplying the contact tracing information as soon as possible when it is requested. This is absolutely critical. And now a quick update regarding the COVID-19 vaccine. I want to reassure members of the public that vaccine selection is a carefully considered process prior to the distribution. The Ministry of Health will monitor the vaccine's rollout in the United Kingdom and ensure the cold chain requirements and any safety concerns before distribution here in Bermuda. When we are independently satisfied that we are going the right way with the right vaccine for our population, then we will start vaccinating our residents and not before. We will start with vaccinating people who are medically vulnerable, seniors, healthcare workers, and the essential workers. In the coming weeks, we will be organizing series of interactive sessions to encourage the public to ask questions and to get direct answers from medical professionals concerning the vaccine. In closing, I would like to ask persons who are contacted by our contact tracers to please be forthcoming with information as it pertains to your close contacts. We need this to be able to trace the potential spread. This confidential information you provide to the contact tracers may help to save a life. Thank you.
Thank you, Minister Wilson. And as I say very often, I want to thank you certainly for your tireless works and efforts in leading the Ministry of Health, and certainly your team for the excellent work in which they continue to do. I know that the last couple of weeks has been tremendously stressful for them. I know that your teams and yourself have worked incredibly long hours. I know that this is not easy, with everyone questioning the decisions of which are being made based on the public health advice and science that that the ministry follows. But I want to thank you on behalf of the country for the work of which you've been doing, because it is certainly appreciated by myself, and I know appreciated by a great many residents of this country. Let me start with an update from the Ministry of Education, and we are joined here by the Minister of Education in case any members of the media have any questions for him. Following a meeting of the Educational Emergency Measures Committee, the Minister of Education, the Honorable Diallo Rebane, has made the decision to suspend in-class learning and transition to remote learning in all of Bermuda's public schools, preschool, primary, middle, and senior schools. The Department of Education, through the principals, have contacted all parents and students to provide them with the details for their respective schools. All students will work on digital and non-digital learning packets on December 9th and 10th to allow staff to prepare for online education. All schools will convert to online teaching and service from December 11th to December 16th, when the school year was scheduled to end. Government is aware of the impact of transitioning to remote learning in our public schools. We have parents, especially parents who are unable to work from home. The Department of Youth and Sport will be contacted to seek their support to care for children during the next 6 days of school term for those parents who must report to work. This decision was made similarly to the decision at the Barclay Institute today, as there were challenges with delivering quality education for our students, given the large number of persons that were under precautionary quarantine. It should be noted that outside of the schools announced already that have been closed due to a positive case, only one more school was added to that list. And there have not been any more confirmed cases reported in any schools, and the results received thus far today, which will be reported tomorrow, do not have any additional students testing positive. It is important to note that this decision does not apply to private schools, private nurseries, or other activities. If you are able to follow the rules and are maintaining protocols, those activities must continue. However, for the public school system, it was important to transition to remote learning to ensure that we can deliver quality instruction while also reducing the stress on our healthcare teams with large quarantines and a significant amount of additional personnel on the basis of a single positive case. Bermuda, I cannot stress how important the next 2 weeks are for our country. Not just how we spend our Christmas or how we end the year, but our actions over the next 2 weeks will greatly impact what 2021 looks like. By now, I am sure that all of Bermuda is aware that we are in the midst of a significant outbreak of the coronavirus here on our shores. The scale and scope of the number of positive cases is alarming and proves that we are not exempt from the realities of the global pandemic. Although our rate of hospitalizations remains comparatively low, this does not decrease the concern I share with Ministry of Health officials of the potential for this outbreak to adversely impact our healthcare system. Let me be clear. I do not subscribe to any of the growing rationalizations around COVID-19 generally, or this outbreak in particular. Mild symptoms or no symptoms at all should comfort no one in this community. The nature of this virus is such that no individual experience. This is not an individual experience. It is a collective danger that is posed and against which we must fight. Thankfully, we know much more than we did in March, when the global pandemic was first declared. The public health advice has been ingrained into us, and outbreaks occur in communities where there has been a lapse in the following of that advice by persons or groups. They may not be Bermudians. They may have been travelers. But nonetheless, we are here. Regulations and harsher penalties alone will not do enough to address the dangers posed by what we are now seeing. It is a matter of personal responsibility as well. The government will do its part by setting out clearly those activities that must now be prohibited or modified to reduce the risk of spreading the virus. The existing clusters of cases demonstrate that large groups in social settings or settings where there's little physical distancing and lax mask wearing are the principal source of transmission. Make no mistake, we are at a crossroad in the island's pandemic story. We have successfully traded on our ability to meet a global challenge with local talent and ingenuity. That has not and will not be allowed to change. We intend to bring to bear the same leadership and critical decision-making that saw us through the days when we had far less testing capacity, when we were not even sure how transmission occurred, and when we were forced to shut our borders and to shelter in place. The key to all of this is our renewed sense of community and responsibility. We must recognize that there is nothing to be gained by devising ways to circumvent the public health regulations so that we can carry on as normal. The next 2 weeks must be anything but normal. The life that is put at risk may not be your own. It may very well be that of someone you love. we have an opportunity to once again re-engage in the same careful conduct that saw us emerge better than expected when we knew less. Now that we know more, we can act more confidently and comply with public health advice in the knowledge that compliance saves lives. I am concerned. I am disappointed. Disappointed that after our success, we find ourselves here. But I draw confidence from the fact that we have the testing and tracing capability to identify positive cases and those at risk of exposure. I know that our hospital is prepared and properly equipped should the need arise. I received reports today that persons went to be tested, and due to the large amounts of persons who showed up, some were turned away. This is a challenge, and as the Minister of Health has stated, we have expanded our testing capacity and our testing resources. But it is also important to note that we are also testing more people, including all contacts of positive cases. It is essential that those persons are tested first. The government is putting additional measures in place to further increase our testing capacity, as the Minister of Health has announced. There was a notice on my social media that there would be walk-in service at Perot tomorrow. The minister has said that that is not going to happen because there are additional positive cases and close contacts need to be tested, as those are higher priority. If you are a close contact and you would have gone through the hotline, you will be able to attend the various testing sites throughout the country by appointment. The Ministry of Health's goal is to be able to test over 1,000 people every day. And with the resources being brought to bear, I am sure that we will exceed this number. The number of testing facilities will increase, as the minister has announced, and we will also work with doctors' offices to further enhance their testing ability so that we can get people tested. Just like the Minister of Health said, I am grateful for the doctors who have stepped up to date, and I look forward to more doctors coming online to assist in this testing effort. Now is the time for us all to come together to help. To further support our increased testing and following conversations with Government House, the Royal Bermuda Regiment will provide 20 soldiers, 12 officers to assist with quarantine monitoring, 6 officers to assist at the testing stations, and 2 officers to assist with testing. These essential resources will help to make a difference for Bermuda. The more people we test, the greater our ability to detect new cases. The more you test, the more you know. And we are testing a great many persons at this time. And it's important to note that many of the persons that we are testing are already in protective quarantine. If you have questions about getting tested, please contact the COVID-19 helpline at 444-2498. Again, that number is 444-2498. They are open from 8 a.m. to 10 p.m. to answer any questions that you may have about getting tested. Also, if you have questions regarding the coronavirus generally, you can always go to the website coronavirus.gov.bm. We each have a role in how we will spend Christmas this year. If we limit our interactions as we move about the island over the next 2 weeks, if we keep our bubbles small and follow all of the public health guidance, we will contain this outbreak. Unfortunately, the activities and the actions taken by the government will have a negative impact on some in this country, specifically those who work in bars and clubs. All persons put out of work will be eligible for assistance, and the Minister of Finance has indicated that the temporary unemployment benefit will be made available again. Persons who have been put out of work in bars and clubs will be eligible for up to $1,000, which will be paid electronically. Additionally, support for business such as restaurants who have seen a decline in business, in addition to bars and clubs who have been ordered to close, especially at this time of year, which is some of the busiest, will need support. The Bermuda Economic Development Corporation will provide grant support during this difficult 2-week period. The details on the grant support that will be provided by the Bermuda Economic Development Corporation is not fully complete, but will be announced before the end of the week so that businesses can avail themselves of the support of which they need for their overheads at a time when they are not going to be able to make any income. So we will support the employees who have been put out of work for these 2 weeks, and we will support the businesses to make sure that the overheads and expenses which they have to meet can be met during this time. I will now talk about the WeHealth app. 2 weeks ago, we announced the pilot test of the WeHealth Bermuda app, a free smartphone application that provides anonymous COVID-19 exposure notifications. This week, I'm pleased to report that the pilot was a success, and the app will launch Bermuda-wide this Friday, December 11th, 2020. Over 3,000 Bermudians have already downloaded the app, and if you haven't done so, download it today. It can be downloaded from the App Store on your phone. Just type in WeHealth Bermuda. WeHealth Bermuda is designed to help slow the spread of COVID-19 by notifying app users of potential exposure to the coronavirus. It is one of the most sophisticated apps available anywhere in the world for helping to control and minimize the spread of this virus. When smartphones that have the WeHealth Bermuda app are installed are near each other, the app uses anonymous Bluetooth signals to determine how close together the devices were and for how long. If someone receives a positive diagnosis, they will receive their positive test results in the regular fashion from the Ministry of Health, not through the app because the app is completely anonymous, and the Ministry of Health will provide them a randomized verification code. Once the user enters the verification code into the app, WeHealth Bermuda will automatically and anonymously notify other app users that an infected person was within close proximity, even if they do not know that person. Because WeHealth Bermuda does not collect personal information, these notifications are completely anonymous. The app is free and will run on iPhone and Android phones. Once you download and install the app on your smartphone, there is nothing else you need to do. The app will run in the background and will alert you to any exposure risk. Our families, neighbors, and communities depend on us to prevent the spread of COVID-19. Pairing WeHealth Bermuda exposure notifications with manual contact tracing and other preventive measures like wearing a mask, physical distancing, and good hand hygiene means better protection for us all. As an example of how this app can be effective, can be found when it was used at the University of Arizona this year. Using the WeHealth app combined with other conventional techniques such as contact tracing, the University of Action from a daily average of 160 to under 5 in only a few weeks. This was achieved by employing targeted quarantine of individuals at high risk of infection rather than mass quarantines or a complete lockdown with on-site classes continuing throughout. They were able to reduce infections by 97% without the need for a lockdown just by using this app. I cannot express how critical this is to our reopening efforts and how essential it is that persons participate with this app. Starting on Friday, you will start seeing social media graphics and information on how to download the app. But let me repeat, you do not have to wait until Friday. Take the time, less than a minute, and download it right now. It is there, and it is, if you download the app, it will collect if you are near to someone with a Bluetooth signal, it will continue to record those items on your phone. Once the app goes live and it is upgraded, that is when the Ministry of Health will be able to send exposure notifications. But it is important and critical that you install the app and leave it running on your phone, especially if you are going to go out in a situation, whether it to be a restaurant or to some other activity. This is essential, especially if you're going to an activity where you'll be around people who you may not know. Your actions will help to make a difference for your family, your neighborhood, and this island. So please encourage your friends, families, and coworkers to download the app as well. Again, the app does not contact or request any personal data, your name, your phone number, your email address. It is completely anonymous, and that means that your privacy is protected. It is in line with all of the privacy protocols, but it will help to protect us. We achieved great results once we were able to learn about the virus and apply science. And I am certain that it was the discipline of Bermudians, the extensive testing, the rules for arriving passengers, the protocols surrounding our activities in the country, and the technology that has been used to assist our fight that has allowed us to be so successful to date. Unfortunately, we have had a setback. When we communicate about the coronavirus, we use words like confirmed cases, infections, hospitalization. But I want to be clear, these words are about humanity. They are about people. COVID-19 cases are people infected with a virus that can cause serious illness or death. Hospitalizations are people being treated knowing that their lives are in danger. Business closures are not about profits or employees losing money. They're about people not having the dignity, pride, and satisfaction that comes from earning a living. 9 coronavirus-related deaths are 9 Bermudian families who lost a loved one. We cannot lose sight of why we have implemented restrictions. We are preserving life and trying to ensure a decent quality of life for all Bermudians once we come through this. Make no mistake, lessons have been learned, and in the next few weeks we will continue to refine our protocols for arriving travelers to ensure that we tighten up anywhere needed to better protect against any future outbreak. I have no doubts that if we keep our unity, our sense of community, and be our brothers and sisters keepers, we will be okay. As leader of this country, it is important that I share with you my optimism, as I am certain that we have the tools to get through this. Our teams have risen to the occasion, and it fills me with pride to see how they have responded and mobilized as a community to ensure this massive testing effort and identification effort and contact tracing effort that we've seen over the past week. Our health teams, our testing teams, our communications teams have all done an amazing job. And our teachers, who are the amazing heroes, amazing unsung heroes of this pandemic. And we must all, as a country, rise to the occasion in the same way. We will have to adjust our behavior. We have all had an opportunity to fall back, and it is unfortunate. Again, it's just simple. Do not greet each other with hugs. Do not shake hands or kiss on the cheek. We must take physically distancing seriously and do what is necessary to contain the virus so that we can slow down the developers of these clusters. As I close, I will again recognize that this is not an easy time for many in our community. There are those who are feeling the stresses and the impacts of the decisions that we have made. There are many in our community who are struggling economically. Some are caring for ill and aging family members. and many are feeling overwhelmed and depressed. As I say every week, you do not have to suffer in silence. There is help that is available, and you can receive support by contacting the Emotional Wellbeing Hotline at 543-1111. Someone will answer your phone and will provide you with support. Again, that number is 543-1111. Also, if you would like to receive regular updates from the government of Bermuda via WhatsApp, please send hi to 533-4360, and we will add you to our distribution list. Again, that phone number is 533-4360. We have continued to send out notifications, but there's been some persons who said they are not receiving them. If you are not, just send hi to 533-4360. This Bermuda is now up to us. As I have said, I am confident that over the next 2 weeks, we will be able to constrain this outbreak, but it is going to require all of us to work together. With that, I'm happy to take any questions that members of the media may have.
Premier, we'll start with the World Gazette.
Good evening, and thanks for having us. Yes, Ms. Wilson, I think I'll start with you. You spoke of, you called them common exposure events. We were wondering, obviously without revealing too much about people's identities, if you could talk us through a bit more of the, I guess, common movements of those people who have been testing positive, who have unknown links. Are they people that have been going to restaurants frequently or meeting with family frequently? Can you give us more on that,
First of all,
perhaps?
Jonathan, I need to commend and thank you for recognizing the need for us to remain confidential with respect to specifics concerning individual cases. I think that's critical, and I thank you for adhering to that request. What the contact tracing team has identified with the new cases that we've spoken about in the last several weeks is the fact that many of these cases can all be linked to social gatherings, places where persons are congregated in very close proximity, not necessarily wearing masks or adhering to the other public health guidelines. So in essence, they're in places that the spread and the contact could have been avoided had they exercised the public health guidelines. So that's what we're referring to, is that they've observed that these are effectively social gatherings where persons had not adhered to public health guidelines, all avoidable.
Right, thank you. Second question was if 20 people are allowed to gather outside, just to be specific, how many people are allowed to be together on the inside? I'm sure people are thinking of Christmas time and things like that.
Well, the public health regulations that have just been signed that we've spoken about over the last couple of days prohibit gatherings in the size of 20. So the maximum gathering size is 20.
20 is what you got.
Beg your pardon?
Yes, so 20 is, that's it.
Correct.
You spoke about the...
Can I just add, though, Jonathan, that doesn't necessarily mean to go out and have 20 people at your house from different bubbles. We're still trying to emphasize the point that we, as particularly for the next several weeks, we're encouraging people to have small bubbles. If you have to have 2 social contacts of bubbles, then limit it to that. It doesn't mean necessary, because if you have 20 people from 20 different households, you've got 20 different bubbles. And remember, every bubble has a bubble.
Thanks. You mentioned the funeral at Malabar. I think that was November 28th.
Yes.
And there's been, was it 9 people
I think I said 9.
that have tested positive?
Yes.
We just wanted to ask, I mean, there were subsequent large events that were allowed to go ahead. There's a funeral on, apparently on December 5th. Why were they allowed to go ahead? Was it just that we didn't know at the time the extent of the spread that had happened at that particular event?
When the contact tracing starts, when there's a particular case and the contact tracing exercise commences, and then in the course of the investigation, it was discovered that there were more persons that were associated with that particular event. However, as a result of that, and as well as the cases that we've seen and the increases, that's why you would note that we have amended our legislation. The governor signed off on it tonight, which allows, like I said, in addition to a requirement of 20, it also means that the large gatherings that we've spoken about, where the Ministry of National Security has power to exercise her discretion to grant large group gatherings, but it also allows for her to revoke any. And you would have heard the Premier speak on Sunday about the revocation of large group gatherings for the next 2 weeks.
With these tracking bracelets that we've heard about, is there any consideration of fitting them on the visitors who are on the mobile quarantine?
Okay, if I may just say something, there are no tracking bracelets. So that's just very pejorative language. So I just want to make sure that we're clear on that. There are no tracking bracelets. There are the quarantine bracelets, which are paired with a phone, which make sure that you stay at your location. There are no tracking bracelets. But the minister will answer the question on the bracelets for travelers.
There's two types of bracelets, right? There's the quarantine monitoring bracelet that is fitted on individuals who do not have a pre-arrival test, and they're required to quarantine for 8 days. And then we have the traveler's wristband that I spoke about that's being implemented from today, which is effectively a bracelet that that identifies. Remember we spoke about last week the 14-day traveler's continuum? So that allows persons to know that that individual is either a visitor or alternatively a resident who has traveled recently to the island, and they will have that band on. So that's what we're referring to as the traveler's wristband. It also allows the traveler to remind themselves that they have a 14-day continuum that we've spoken about insofar as what activities they can and cannot do during that 14-day traveler's continuum. We've been calling it the traveler's first 14 days.
Yeah, I guess what I was referring to erroneously was the quarantine monitoring bracelet.
I thought, yeah, exactly, yes. It's the monitoring bracelet is the bracelet that is fitted on individuals, like I said, who have arrived to Bermuda and do not have a pre-test. And they wear that for 8 days because there's an 8-day quarantine.
But what I was asking, is there any chance of expanding that to, the folks who are on mobile quarantine?
Well, we're trying to get away from the phrase mobile quarantine because unfortunately it's caused a little bit of disquiet in the community because mobile suggests movement and quarantine suggests stay, which is why we're calling it the traveler's 14 days, first 14 days. However, insofar as the use of the monitoring bracelet that you're speaking about, again, it's for those individuals that do not have a pre-test, or alternatively, in certain slight circumstances where we've observed that persons may not necessarily adhere to the 14-day quarantine, then those persons are fitted with a bracelet. But more often than not, it's used for persons arriving in Bermuda that do not have a pre-test.
Thanks.
Just so we're clear, the technology is for them to stay in one place. It's not to follow around.
Right. Gotcha, sir. Yeah, I guess my last one. I mean, hindsight being what it is, obviously we brought in these measures now. Would we have preferred to have implemented these measures, say, last week, when we started to see the numbers going up, rather than waiting until this week? Obviously, it's not pointing a finger, but last week we did start to see these numbers start to
correct. We meet very regularly. There's the Cabinet Committee, COVID subcommittee that meets regularly. We have ministry meetings within the Ministry of Health daily concerning a number of matters as it relates to COVID and the levels of transmission. So we have been watching the space, and it was decided when we publicized the information on Sunday. Cabinet met, and we decided that there should be some further restrictions with respect to movements and the like to try to address the issue that we've seen with respect to the rise in cases. But again, as the Premier indicated, I think it's critically important that we recognize that this rise in cases is all avoidable. We should not be in this position that we're seeing ourselves in right now. And the fact that people are failing to adhere to public health guidance is why we're here. And it's extremely unfortunate because we've done so well for so long that the circumstance that we're in is entirely preventable.
Jonathan, we got complacent and we believed our own hype. And certainly there's responsibility on that for all of us. When you have certain clusters with 22 persons from a particular event, I remember speaking from this place here a few weeks ago in saying that, where people were criticizing us for, targeting bars and targeting certain establishments and certain types of places. And the fact is, if you're in an environment where you cannot wear a mask, it is important that you are observing those precautions. And just as I said, that one person inside of a room could end up infecting 30 people in a few hours, we're seeing these very large clusters which have emerged. And so I don't want to overstate where we are, but I'm not trying to understate where we are either. I think that we have taken quick action when we had seen this surge taking place. Could we have acted sooner last week or 2 weeks before? Yes, we could have. Absolutely. Is there probably, if we have something else in the future where we might act sooner? Possibly, we will consider that. But where we are right now is that we have identified clusters, a team of contact tracers that is working diligently and very hard. And it's important that we provide the ability for them to have some breathing room with these matters and issues. So we have a whole lot of testing that is going on in this country right now. We have more technology tools that we're going to be able to deploy this week Friday to aid us in combating exposures that people may have. The community is responding and making sure that they are making themselves available for testing, giving information to contact tracers, etc. And I think that we will certainly do better. As the minister has indicated, we've now revised our routine for incoming travelers, tightened some of the restrictions which we feel are necessary, given the fact that there are increasing cases overseas. And I think that, combined with the strong action which we've taken now, will allow us to return back to our place of a relatively new normal. We have the capacity, but what we must have over the next 2 weeks is everyone's cooperation.
Thanks, sir. And I will get that app tonight. Scouts Honor, I will download that app.
Thank you very much, Jonathan. We Health Bermuda.
Bermuda Broadcasting.
Good evening, Don Burgess, Bermuda Broadcasting. Health Minister, I was glad to hear that there's going to be increased testing available because the last couple of days I've heard people trying to get in and book tests and they haven't been able to.
And we have a central one just for you.
That's awesome news. Do you know what percentage increase the testing availability is going to be?
I don't. What normally happens is they test approximately 3 people every 5 minutes. And I know that we've extended each facility by several hours in the beginning of the day and in the evening. So there will be certainly enhanced capabilities for testing because of the extension of the hours, particularly as well as the fact that they will be able to be moved indoors if there's inclement weather. So we won't have to just cancel a pop-up because it's raining.
Yeah. And just from your statement earlier today, just to make sure I heard it correctly, you said that those new bookings will be available tonight?
Correct. That's
Okay.
correct. Yeah. Can I just also add, I think, as the Premier indicated, we have done an enormous amount of testing in Bermuda. We are like one of the top tested countries in the world. Just over the last 10 days, we've tested over 8,000, run over 8,000 tests. So we've always said it, very aggressive in our testing, and the fact that we are making more options available by having these sites that will be fixed locations. So you'll know every Monday it's at such and such. Every Tuesday will not change because of the weather. There'll be fixtures on the calendar, and as of this evening, you can go ahead and start logging onto the coronavirus.gov.bm and schedule your testing appointment.
Okay, thank you very much. You talked a little bit about vaccinations and getting the vaccine. In the UK, you said it started. Government has said Bermuda will be getting the vaccines as part of the overseas territories as well as via COVAX facility. Are there any regulatory steps necessary for Bermuda before the vaccine can be approved and implemented here? And when will the first doses arrive on the island?
The approval mechanisms with respect to the vaccine in Bermuda will similarly be those that are adopted overseas. So if the equivalent of, for example, the FDA in the United States, and then I can't think of the name of the person that the association in the United Kingdom that verified the Pfizer. Once that process has been taken place, then we too will do our own independent review to make sure that it adheres to our standards and make sure that it does what it says it's going to do. So obviously, we'll yield to the research and the data that's been driven by these particular institutions that have already had the vaccine validated. And so far, there's only been the one, which is the one out of the United Kingdom. So we'll do our own internal processes as well, but mostly it will be guided by the recommendations of the international bodies that have approved those vaccines in either the United States or alternatively the UK.
Okay, and the second part of that question is to when we can expect the vaccines on the island?
We had a meeting, I believe, last week with Public Health England, and they were anticipating that we would be able to receive them, I think, within the next week or two. I can advise that on Friday I will be delivering a ministerial statement that will provide the most current, full, up-to-date information that we have currently with respect to vaccines.
Okay, thank you. The rising number of active cases is alarming. We're at a high point right now, and if a vaccine is set to arrive here in a matter of days or weeks, should we not apply the hammer and dance method right now and drive the active case numbers down and get things really going before they get out of control?
I'm sorry, I'm not familiar with that phrase. So
Make more restrictions before the cases continue. Like today, for example, we had 24 cases, which ties the record which we had back on April 15th, and we had 18 2 days ago, which was now the third highest number that we've had. So should we be putting in more restrictions to keep the numbers down?
Well, we think that...
If I could, I'm so sorry. I don't want you to not answer that question.
That's okay.
I'm very sorry. I have to interrupt. Everyone who's watching, unfortunately, I gave out an incorrect phone number for the WhatsApp line, and I just received a message that someone's phone is ringing off the hook, and it is a private phone number, and I'm very sorry. I can only read the information that has been put in front of me. Please, the WhatsApp phone number is 504-6045. That is 504-6045. I'm going to ask the team if they can put that on the screen, possibly. 504-6045. To whoever number that was, I am very, very sorry. 504-6045. Minister, you can deal with that hammer.
I'm sorry, I was a little distracted. Can you just repeat that again, John? I'm sorry.
I was hoping, like the premier said, like he was going to offer that person a personal dinner or lunch with them, whoever they are. But because we've had 24 cases today and 18 cases, I mean, that's the most and the third most amount of cases that we've had, and the numbers continue to rise. Should we not put even more restrictions in place to try to keep the numbers down as low as possible until the vaccine can arrive?
Right. The question concerning restrictions and where we are and whether we should be imposing more is a question that is constantly discussed at the cabinet level. In fact, we discussed it again today. So it is certainly a live issue, and we will review it regularly based on the circumstances. However, as the contact tracers have been able to identify, the majority of the current cases that we've seen are effectively tied to two cluster of cases, of events that largely social gatherings where persons were not wearing masks, not properly physically distancing, and not adhering to the public health guidelines. Again, all avoidable. So, though we will continue to monitor the circumstances, we do day by day to see whether or not we need to provide in more mitigants and more tightening up. I just want to make sure that everybody appreciates that the majority of the cases that we've seen recently are tied to events that are social in nature.
You mentioned the contact tracers, and we've talked about the rising number of cases. Just how stretched are the contact tracers at this point? I mean, with the rising numbers, and we've got, you mentioned the 3 events on the 28th, 29th, plus the funeral. Do we have enough contact tracers to handle increasing workload?
John, I'm fortunate to work with a really great team at the Ministry of Health, and part of that team includes the contact tracing team. And they're like little private eyes. They're investigators, and they're scurrying around in their corners, making calls, helping to case manage people, because obviously if a person's a positive, then they need to, be able to address with them with sensitivity, as well as to gather the information of who their close contacts are. So it is a very important role, and they are extremely stretched right now, which is all the more reason why I find it frustrating when persons are not adhering to public health guidelines, when we have persons that have, spent a large portion of their year away from their family trying to protect Bermuda, but people aren't adhering to the guidance. And we need to ensure not only that we adhere to the guidance so that our health team isn't stretched, but we certainly don't want to get to a situation where our health system, in particular the hospital, is overwhelmed.
It's almost like you're reading my questions in order here, but because it leads right into the next one. Because you talked about your frustration with that, and last week you announced the fines for not wearing the mask, and it seems like it's slightly better, but not completely. I did sort of an informal survey yesterday and today of Front and Reed streets, and out of 143 people, 29 were not wearing a mask, which is just over 20%.
Right.
And I don't know, maybe the Premier wants to weigh in on this as well. But when you, what is your reaction when you see numerous people ignoring the law?
Still represent 20% of the people not wearing a mask, because anecdotally and based on my own observations, we're seeing an increase in persons wearing a mask. Whether the fine is probably it's probably a disincentive, is knowing you can get fined $500. But we have seen anecdotally that there has been an increase in persons wearing a mask. You'll recall that we've spoken about the Health IQ app since probably April when it was rolled out, and we're still encouraging persons to download that app and to fill in the information, and based on what they're observing insofar as whether or not they're seeing people physically distanced wearing masks and the like. But certainly anecdotally we are seeing that there has been a change in behavior and a more of an awareness of utilizing the necessary mask wearing and wearing it properly.
Okay, thank you very much. Have a
Thank
lovely
you.
evening.
Premier, we now have Media Maya.
Good evening. Good evening, Maya Palacio here from Media Maya. My first question, which may have been similar to what Don may have asked, is will you be increasing the COVID hotline workers? Because there's been so many people calling the hotline, they're saying they can't get through to anybody. So will those numbers be increased?
Insofar as staffing, I do not believe so. We have increased the hours. We have also implemented it's like an automatic call. You're put on hold. I'm not sure what the proper terminology is, but it is manned, and we've extended the hours for the facility, and I can't say whether offhand we're looking to employ more persons, but we certainly have extended the hours to address the increase in demand of calls.
Thank you very much. And again, for you, Minister Wilson, what does the wristband look like exactly? What's the color of it? And how can
It's
people
yellow
identify it?
right now. It is a yellow wristband, and it's a fluorescent bright, almost like the yellow of that microphone. And for those of that may not be aware, yellow is the color, the international color for quarantine.
Thank you very much. And Minister or Premier can answer this. What was the average age of today's positive cases, the 24 cases?
Want me to answer? Average age, 31. Median age of the 24 cases, I believe, was 23. That was the median age. So yes, it is younger.
Question from a member of the community. If a church wants to have a drive-in service where people remain in their cars, is it still limited to 20 people?
The large gathering sizes are churches. Large gatherings are 20, but church activities are exempt.
Capacity.
Right. It's the capacity of where you can physically distance. So if you're, I guess, on a field, as long as you've got physical distancing between the cars. But churches are exempt from that particular 20 maximum large gathering rule.
Yes.
Thank you.
Services. services, church services.
Thank you.
Church services, as per the regulations that were laid out, churches are limited to 20% capacity indoors.
Thank you. And Mr. Premier, this question's for you. For people out of work, you mentioned that there will be a temporary unemployment benefit, and you said it will be the sum of $1,000. Is that $1,000 a week or $1,000 for the 2 weeks?
$1,000 for 2 weeks. The law was it was $500 per week. Those funds we made available. We're trying to make sure that we streamline the process. We certainly know that there are individuals who, in the business which have been forced to close, such as bars and nightclubs. We also recognize that for persons in the hospitality industry, restaurants and otherwise, due to the fear, are that persons are not going out to eat at restaurants and other things. What I would say is I would encourage, the fact is that, yes, we do have an outbreak. And yes, we do have a lot of cases that are active right now, but our health teams have done a really good job. I will continue to support our local establishments following the precautions of which are being laid out. And I would encourage persons who are able to do so, who are not on quarantine, to go ahead and to do so too. But recognizing that restaurants will have reduced capacity and services as well, because persons will not be going to those places as much as they would have been doing, especially in that busy season. We're going to look to provide income support also to restaurant workers, in addition to supporting the businesses such as restaurants and bars and nightclubs with their overheads, which will certainly be a factor in this time. They'll still have to pay rent at the end of the month. Their health insurance and social insurance will still need to be paid, and of course the power bills won't go away. And so we're cognizant of that. And the last thing that we want to do is, make people choose between, obeying what they need to do and going out. And so that's important. Additionally, for persons on quarantine, that will be handled where persons can go ahead and apply. But for persons in the persons in bars and nightclubs specifically, we're going to make sure that we provide direct relief. We're also going to provide income support to those persons over the next 2 weeks in restaurants. But it is important to note that if you abide by the guidelines which we've laid out, install the We Health app on your phone, go out and eat in your groups, and go out and support. It's not a license to stop what it is that we're doing, but it is a license to remember that we must follow the precautions of which have been laid out. The precautions are proof positive, and they work.
Thank you. My next question is for the Minister of Education.
Minister of Education, you got a question?
Evening, Minister.
Good evening.
My question for you, probably months back now, there were laptops that were given to the ministry to distribute to the students. Were they ever distributed, and how were they distributed?
And thank you, Media Maya, for allowing me to clarify that, because I do understand that there is a persistent narrative on social media that laptops were given to the ministry to be distributed. And let me explain. Back during the pandemic, we received laptops from a few of the IB companies, and those were specifically for teachers. Those have been distributed. We received a grant from the Hassel-Plattner Foundation of around $600,000. All of that money has been used to order laptops, which I made a statement on last week, that those laptops were ordered in August when we received the money, and unfortunately they are on back order. We expect to get them in December.
Okay, thank you very much.
You're welcome.
And also, so another question for you pertaining the schools today, that they have now been, all public schools are now doing remote learning. How long would that be for?
The end of the term is next week, Wednesday.
So it'll be until the end of the term?
Yes.
Okay, and then also for the fact that if we look back into when schools started to get that close contact, it started out from actually nurseries and then moved to primary, moved to middle. Now we're in high school. Was there any thought, when you saw it gradually moving up from year level to year level, to stop it any sooner and quickly, go back to remote learning?
Our COVID guidelines within our schools have proven to be very safe. There has not been any student or any teacher that has contracted COVID within any of our school buildings. And so our our guidelines for working. And so until they were proven not to be working, we would have continued on. What we are doing now is out of an abundance of the fact that our teachers, because of them being quarantined due to incidences that have happened outside of our schools, we're finding that we're having challenges with our staff within the school system. And so so we've decided to go remotely because we're seeing staff not coming into the institutions based on the fact that they have to quarantine or they are generally sick. The idea, and I'll give you an example of the Barclay Institute. When we had a discussion with them last night, they had 23 staff out sick, which represents over 20% of the staff. And so in order for us to maintain the high quality of education, we've decided that it's better for us to go to remote at this point.
Okay, thank you. And my final question is actually for Minister Wilson. When persons get tested for COVID at the stations, are they also tested for the flu virus as well?
It depends. If they're tested privately at their physicians, then oftentimes the physician, depending on the circumstance, will test them for both viruses.
Okay, thank you very much.
Premier, we have Trevor Lindsay on the line. Go ahead, Trevor.
Good evening. Trevor Lindsay via cell phone, TNN. Premier or Minister of Health, the frontline workers that have been put in place to work at these testing locations are mostly part-time or short-term government employees. And some are classified as independent contractors. Many have been required to get their own health insurance, resulting in many getting bare minimum of HIP insurance. Do you think the government should cover these workers with comprehensive insurance, knowing they are working, knowing they are working at high-risk environments right now based on COVID-19?
Many of those persons that you spoke about, the vast majority are not part-time, but they are contract workers. So under government, under the terms of the contract, oftentimes persons that are contract workers are responsible for securing their own insurance. They're paid at a straight time, and then they secure their own individual private insurance. Some of them may have HIP, some may have major medical. I don't know the particular circumstances, but as is most of the case, when you're a contract worker or a consultant, you're responsible for paying your own pension and insurance.
Next question.
On the same note, some of them are working between the contracts are between 3 to 4 months. Are there any thought of hiring these individuals full time, being said these testing facilities are going to be around for a little while, at least a year or more?
That's not something that that's not something that I have any type of day-to-day involvement with. We do have the Incident Command that are actually responsible for hiring the testers, so that's just something that they deal with themselves. I think that at this point there are, the majority of them are actually consultant contractors that are there full-time. Some of them may have other sources of employment and be filling in part-time, but that's not a matter that I have day-to-day involvement with.
The only thing,
Hold on.
Thank you, Trevor. What I will say is, Trevor, is that I recognize and understand where the question, the point at which you're coming from. One of the things of which we've stated is that persons on long-term temporary contracts should be entitled to some benefits. I'll go ahead and have a look of that because if they are persons that are on long-term contracts, I do not want them to be in long-term contracts without benefits, and see what, if anything, can be provided. So thank you for raising that issue, and happy to go ahead and take a look at that, because that is something that we've said from a government perspective that we do not encourage in the private sector. So it's certainly not something that we want to have in the public sector. And I know that in the government there were persons in that circumstance of which we found the measure to make sure they can at least have some measure of benefits.
Next question.
Tonight, and I'm sure I'm going to ask the same question. This 4412898 hotline number has been extremely overworked, I would say. Are there any thoughts of putting another number, contact number, or a few contact numbers for individuals to call? My reasons why I asked that, there's been a group of persons that I know personally that have been trying these numbers to get results after being tested over the weekend, and 3 days have gone by and they still doesn't have no results from their tests.
That the COVID hotline has been very, very busy as of late. And like I said, what we've done to address that is to not only extend the hours of operation, but also to provide, forgive me, I don't know what it's basically an answering machine so that you can leave your contact details and then you'll be called back. We've always maintained that the results of testing normally are within 24 to 48 hours. And generally speaking, we do adhere to that. I've actually addressed a couple of emails from some persons today that have been tested on Sunday and hadn't had their results yet, but they have had them. So, and they are within the 48 hours.
Next question.
Next question. Will GEHI cover the cost of COVID testing at private labs? Currently, there are only one who do not pay the cost of tests at this private facility. Booking online, these organizations, the booking online are now stretching out to January. And earlier tonight, you did indicate that you would make contact with private test facilities.
What I said earlier tonight, I indicated that we, as of the 14th of December, were setting up new testing facilities, and those hours have been extended so that there would be more availability for persons to book online for their testing, and they can commence that tonight. With respect to your question about GHI, I need to confirm that, but to my knowledge, the testing is free, so I don't believe that there's any reimbursement from GHI or any other insurance institution for the COVID test, unless it's perhaps a fuller panel, including a flu. I don't know that offhand, though, because it's free to the members of the public, so.
And Mr. Lindsay, I'd just like to confirm that the Ministry of Health and their excellent team have updated the testing locations. So testing is not in January. There's testing available next week. And I do understand that there is attempts to even make additional pop-ups over the next few days. But again, the focus is to make sure that we deal with the close contacts and those other persons, as this is a scientific effort as much as it is a community effort. And that's where the intents are focused. That's the reason why these numbers are rising so quickly, because the Ministry of Health has been able to contact persons who may have been exposed, to get them to testing and to make sure that they are isolated, and to contact their contacts and to get them tested and to make sure they're isolated, etc. That's what this is about. Before, that was not necessarily the that strong effort. And in individuals, as I explained on Sunday night, because there was limited testing capacity. If there was a house and there were persons inside the house, they're quarantined in the house, we wouldn't use our limited testing capacity to test those people. Now we test those people. And so there were people who were symptomatic who we didn't test at that time. This is just a different time and a different effort of where we are. And so it's important to keep it in context, certainly. It's important to, look at the positivity rate, look at the amount of people of whom we're testing, etc. And so from this perspective, we are Catch the People. It is a measure of the incredible work of the Ministry of Health teams. And we will continue to see new cases as we continue to contacts of persons of whom we know, just to make sure that we are constraining this current outbreak. If we work together, I'm confident we will, Trevor. But there are new testing lanes that are open, so that is available there.
And Trevor, I have to check on that question that you asked about GEHI, because I do know that, if you go to the testing facilities, it's free, but I need to confirm that if you go to a private physician, what is the status insofar as the reimbursement rate for the insurance. So I'll have to find out, Trevor, and I'll get back to you.
All right. Any further questions?
Yes, that's my fifth question coming up. Premier or Health Minister, we seem to be under the number of 100 positive cases in Bermuda with a population of 60,000 people. There is 100 to 1% full recovery, with a full recovery rate of 99. Are you alarmed, or how do you feel at our position right now? We only have basically 1% of our population, not even our population. And it's a 99% recovery rate. So, is it any need to panic?
Trevor, there is not a need to panic. but there is a need to follow public health guidelines. That is key. And I want to state it again. Yes, the number of cases is alarming without question, but it is due to the fact that we are the 5th most tested country in the world. We have deployed amazing testing capacity. We've tested almost 15% of our population in the last week. So we are doing that work, and we are doing the work which is necessary. And the tests which are reported don't even match the saliva test screenings which are taking place as well. That is just only reporting the nasal pharyngeal tests. We're doing massive saliva screenings across the country as well. So we have the ability to deploy significant testing capacity. And so that is the reason why we're seeing the cases. It is not a time to panic, but it is a time to pause, to make sure that the contact tracers can catch up with what they're doing, to ensure that we do not have large super spreading events, which are leading to these very large numbers of outbreaks. And so we can find out where those cases are, and to ensure that we can constrain this outbreak. So no, it is not a time to panic. What it is a time to adhere to the public health guidance very, very firmly.
Any further questions?
And my last question, Premier, there seems to be a lot of discussion of Bill Gates visiting Bermuda quite a few days ago. Are there any truth to that? Have you had any meetings with Bill Gates?
I am an IT person, and I remember I grew up in the age when Microsoft was created. I would have loved to have had an opportunity to sit down and have a conversation from an IT perspective with Bill Gates. I have not met Bill Gates. I do not know if he was in Bermuda recently. I have no information that he was in Bermuda recently. I do understand that he and his family may have been here over the summer. I do not have information that he's been here recently, and I have not met with him. But what I will say is that there are a lot of persons who may have, for one reason or another, affiliate persons on whatever activities they're involved in. Let me be clear. The vaccine that is going to be made available to this country is a revolutionary type of medicine. And I hope that Dr. Weldon, I know that Dr. Weldon has explained it, because that's actually how I got to meet Dr. Weldon, talking about genes and how there are new types of medicines in the world. The vaccines, the Moderna vaccine, the Pfizer vaccine is the one that will be supplied to Bermuda shortly, is revolutionary medicine. It is absolutely revolutionary. And I think that it is going to be massive advances in science. I'm not going to get into the debates where persons are talking about the conspiracy theories and all the other things which they're going to say. What I'm going to say is that I am grateful that Bermuda is going to have access to a therapeutic vaccine that has been found to have a 95% efficacy, which is far and above any vaccine that has been produced in human history. This is important. It is something that is an advance for science inside of this world. And whether people like Bill Gates, don't like Bill Gates, like whomever else, or don't like whomever else, the fact is that this vaccine will help to end the pandemic. No one's going to be forced to take it, but those persons who will do their research are welcome to have access to it, and we will ensure that we have the access to that vaccine so that persons can go ahead and get themselves vaccinated.
Thank you, Premier. If there are no further questions.
Thank you very much. Before I close, I saw a few comments. Someone sent me a WhatsApp message and asked me if I'm feeling okay or if I have been tested. Just as a note, I get tested twice a week. So I am, as of yesterday, I am certainly got a negative result from the Bermuda Government Molecular Diagnostic Laboratory. That doesn't mean that I do not continue to take my precautions, wearing the mask and doing what's necessary, and that's important that everyone does that as well. Bermuda, this was a relatively long press conference. A lot of information was shared. And as we stated and indicated from the Minister of Health's perspective and from my perspective, we are in a critical phase. Please obey public health guidance. Please wear a mask. Stop shaking hands. Stop hugging. Stop kissing. Let us make sure that we do what is necessary over this pause that has been implemented over the next 2 weeks so that we can grasp the scale of this outbreak and get to a place where we can enjoy our Christmas holiday. The last thing that I want to do is to extend this further or to have to move to more stricter measures because we aren't able to control the spread. We have the tools, we have the technology, we have the ability, and I'm certain that with our cooperation, we will be okay. Thank you very much for your attention. Thank you, Bermuda, and good night.